Optimizing Telehealth, the premium resource for evidence-based strategies to enhance telepractice today. Brought to you by the Telebehavioral Health Institute. Enjoy this excerpt from the latest episode. To access the full episode and to get your continuing medical education and continuing education hours, visit us at Telehealth.org.
Hello, I'm Dr. Marlene Maheu, and I'm delighted to welcome you to the Optimizing Telehealth podcast, where you can participate in collegial discussion with interprofessional telehealth thought leaders from around the world. Dr. Shauna Wright is the Associate Director of the Kansas University Center for Telemedicine and Telehealth. Dr. Allison Crawford is a psychiatrist and Associate Chief of Virtual Mental Health and Outreach at the Center for Addiction and Mental Health, and she's an associate professor in the departments of psychiatry and Dalla Lana School of Public Health at the University of Toronto.
Dr. Marlene Maheu has written more than 40 peer-reviewed telehealth book chapters and journal articles and is the lead author of 5 telehealth textbooks. She enjoys giving telehealth keynotes, training, consulting, and helping organizations meet their staffing needs. She is a telehealth pioneer.
Shauna, what are the provider-related factors that support successful telehealth delivery from your perspective?
I know many colleagues, after they had stepped into telehealth and then received some training, their adoption and comfort really improved.
Allison, would you please talk with us about how to know if telehealth practice is appropriate for a specific patient or client?
The most important term is it patient-centered? It really has to do with, can you meet the patient's clinical needs? So from a technical point of view, the slide deals with some of the technical factors. You need to be able to see and have enough to base your assessments on and your interventions on. That has to do with, do you have appropriate connection? Things like internet speed. Is there privacy for the patient and also for yourself? Can you see clearly? Can you hear clearly? And also, can you safely assess the patient and do an intervention? I think these are all different factors, and we all know from clinical experience how to do this, but thinking about how to do it in a virtual setting sometimes requires some adaptation.
I would like to point out that prior to the pandemic, most of what we knew about telehealth through research and practice was delivering telehealth to supervised settings, whether that be a mental health center or a skilled nursing facility. Often those supervised settings had another licensed or trained professional to support the client or patient on the receiving end. And when we're reaching into the home or a place of work, those are unsupervised settings, which puts a higher burden on the provider to make sure all of these things are in check. 1, so that we can deliver a high quality of care, but 2, so that we can ensure safety and effectiveness in the care that we're delivering. There's a larger burden for the provider when we're reaching into the unsupervised settings.
Shauna, could you talk a little bit about how to document what we're doing?
When we look at those factors that inform us if telehealth is appropriate, everything from the provider comfort to the patient or client comfort, the environment, the technology, we can document that we've made that assessment in a variety of places. Oftentimes we'll start with informed consent, because when we're providing an effective and efficient informed consent regarding telehealth, a lot of those factors are assessed and discussed with our clients. Now, when we meet with them in our sessions and our regular care, we can also continue that assessment, right? We might meet with a client who is living in a certain area where they have good internet connectivity, and then they might decide to join us from a workplace, or they might move. And when that happens, we have to document, wow, I don't know if internet connectivity is strong enough to really effectively deliver telehealth care right now. So we need to be documenting any changes as we go along in the client's notes. And if for any reason the use of telehealth causes us to step out of our normal and expected standard of care, we need to explain that and justify that in our notes as we move along, as well as if we run into any barriers or issues in our telehealth sessions. We need to document those in our notes, and we need to identify how we work around those. For instance, if we're having some difficulty with an internet connection, we might decide to leave our video on with the platform, but connect through audio with a phone. And that way we still have audio and visual connection enough to check the boxes to bill for a telehealth appointment. But we'd want to document in the note what steps we're taking when barriers show up.
I have a comment. The idea of supervised versus unsupervised settings and the implications for telehealth I find interesting because I've worked in a lot of clinics over the years where really, frankly, the confidentiality because of the closeness of offices and the lack of appropriate, barrier between the walls and so forth, it may in fact, or my experience is that, right now I'm in my home and there's nobody here. It's totally private, where if I could be in a clinic and it could actually be less confidential.
I think that's a good point. I can see you right now, but I have no idea if there are 10 people surrounding you outside of the screen. And we think about that for patients, and I think it directly links to safety. It's one factor in thinking about safety. And I'm thinking about some clients I've worked with who actually don't live in safe situations, yet we're relying on them to tell us that they're alone and have privacy. So when we prep patients, we also talk to them about how they can improve the privacy, even if they can't ensure it completely. So using a headset is one example, or turning your screen to the wall. There are also international safety signs. So putting your thumb in front of your palm and tucking your fingers over is a sign that you need help. That's maybe more on the extreme end. But I think what you're saying is true. We all have to think about the configurations of our space as well, because I think where we are also gives clients a more felt sense of safety or not.
Thanks for listening to this excerpt from the latest episode of Optimizing Telehealth, your premium resource for evidence-based care. To access the full episode and to get your continuing medical education and continuing education hours, go to optimizingtelehealth.org.